High blood pressure sometimes can be referred to as a silent killer because some of you, when your blood pressure begins to rise, you don't know it, you are not aware of it, and it might not show you any signs that your blood pressure is getting rise, and this will eventually lead you to serious complications. Hello wonderful, you're welcome to our channel. If you are just joining us, make sure you subscribe, and if you've been with us, make sure you like. Today we are going to talk about blood pressure. The blood pressure is the force exerted in the wall of an artery during the contraction and relaxation of the heart, and as the blood flows to your body. Your blood pressure is expressed in two numbers, which is the systolic and the diastolic. The systolic number is the top number, while the diastolic number is the bottom number. The systolic pressure is the force exerted on the wall of an artery when the heart is beating and trying to pump blood to all the body, while the diastolic pressure is the force exerted on the wall of an artery when the heart is relaxed or is at rest. Your blood pressure can go up and down. That means there can be a different readings in your blood pressure, especially when you check them in two rows in different times. Certain things or risk factors can trigger your blood pressure to rise at any time, like your stress and anxiety, and even sometimes your blood pressure can go up due to age-related factor. As you age in life, it tends to increase your blood pressure. Your normal blood pressure is 120 mm mercury systolic and 80 mm mercury diastolic. When your blood pressure is high, it is termed as high blood pressure, and when your blood pressure is low, it is termed as low blood pressure. When you have high blood pressure, this is very dangerous because it can lead you to many other conditions. It can initiate your stroke, your heart attacks, it gives you vision problems and other health related issues. When one is being overweight, this can cause your high blood pressure to also go up because at this time, your heart finds it more harder and more difficult to pump enough blood for circulation. Also, eating too much salt, taking alcohol, and even practicing too little exercise can raise your blood pressure above the normal range. When you don't exercise regularly, this can create problems for you and bring more problems to your heart by pumping harder to make sure it pumps enough blood into circulation for body use. When your doctor finds out that your blood pressure is high, he may tell you to make some lifestyle changes such as eating better, managing your stress balance, and practicing some little exercises every day. Then aside your lifestyle changes, your doctor may also prescribe some blood pressure drugs for you, such as your beta-adrenergic, your ACE inhibitors, and your diuretics. High blood pressure sometimes can be referred to as a silent killer because some of you, when your blood pressure begins to rise, you don't know it, you are not aware of it, and it might not show you any signs that your blood pressure is getting rise, and this will eventually lead you to serious complications. That is why it is always necessary for you to check your blood pressure time to time, more often, go for a regular checkup, make some lifestyle changes, eat well-balanced diet, and if you are a known hypertensive or you are already living with a hypertensive, make sure you stick to your medication regimen and do not skip it for any reason. This will help you for your better health. Get this awareness of high blood pressure, know how you can treat it or prevent it, make some lifestyle changes, and make sure you don't get caught up with this silent killer. I hope by this time you have liked the video, and if you've not, that's another sign of high blood pressure. See you in the next video.